What's up, guys? How's it going? Cade More with More Muscle, and today we're going to be talking about mental health, and we're going to be talking about we're going to have some questions and some answers. It's going to be a 10-question quiz. This can help you with your mental health. So, guys, question is binge eating disorder. What should you expect? And the answer is abdominal pain and excessive amounts of food at like one time. Guys, binge eating disorder is when someone doesn't have control of how much they eat, and they just eat and eat and eat. They just don't have that feeling of fullness, and they just keep on eating. And they usually try and combat this with making themselves throw up, taking like Miralax to help them just get it out of them, or even excessive exercise. Okay, guys, next one is dementia. What should you expect? Okay, guys, for dementia patients, this is when they lose, they're losing their brain, and this is irreversible. Sadly, there are medications that help, but it is irreversible as of right now. Hopefully there's a medication that could reverse it soon. But impaired judgment, loss of ability to reason properly, and they won't be able to think abstractly, and they won't be able to have rational thoughts. So dementia is progressive. The difference between dementia and delirium, guys, dementia is long-term, delirium is fast. Okay, the next thing, substance use disorder. What should you expect? Slurred speech, alcohol and breath, urge to use substance, issue fulfilling responsibilities, and withdrawal symptoms. So guys, that's alcohol, that's alcohol, or that's excessive opioids, marijuana, whatever it is. But it's gonna basically impair your ability to fulfill responsibilities. That's not something you want. Okay, the next thing is if a client has alcohol disorder, alcohol use disorder, what should you give? And the medication is diazepam. This will help minimize manifestations of alcohol withdrawal. Guys, of course, make sure you follow the prescription, and make sure you take this diazepam properly. Diazepam can actually, can be addictive, So you want to make sure the diazepam is given correctly. Okay, guys, next one is what would you give for a patient that has bipolar disorder? A big one is lithium. Guys, lithium reduces manic episodes and helps the CNS system. And lithium interacts with a lot of medications. It can cause low sodium levels. So you want to make sure you're eating enough sodium, and you want to take exactly as directed. And you want to let your doctor or provider know if you are on a low salt diet. Too little salt could cause some serious side effects, and you may need to drink extra fluids as well. And lithium, there are some serious, you want to have your level between 0.6 to 1.2. Anything above 1.2, you want to hold the medication. So you'll have to get, a lot of blood draws for that. Anyways, guys, that's lithium. It can help with bipolar disorder. Bipolar disorder is when you have lots of ups and downs, and you have a little bit of mania and depression. So anyways, let's go to the next one. What can help with withdrawal from nicotine? And the answer is nicotine lozenges. And you don't want to take more than 5 within 6-hour period, or 20 in a day. Lozenges take about 20 to 30 minutes to dissolve. Side effects, could be an allergic reaction, heart palpitations, and increase in blood pressure. Guys, remember, nicotine is a stimulant. That means your blood pressure is going to go up, your heart rate's going to go up, and that's why a lot of people have heart issues when they smoke excessively, because their blood vessels constrict, and that can be hard on the heart. Nicotine is a stimulant. It's going to make your blood pressure go up. It's going to increase your heart rate, and it is a stimulant. Next thing is a patient has dementia. What setting should the patient be kept in? And the answer is a low stimulation environment. That's because, if it's a high stimulation environment, they could get anxious. You want to keep them in a low stimulation environment if they have dementia. Okay, what are adequate lithium levels for bipolar disorder, guys? I already said this, but it's 0.6 to 1.2. You want to, maintain adequate water absorption and adequate salt. Lithium can deplete salt in your body. So guys, remember, lithium can deplete salt in your body. Okay, the next thing. A patient states they have depression. What is your priority? So guys, if your friend states that they have depression, or if your patient or whatever, they say they got depression, your number one priority is, have you thought of harming yourself? Because that's very serious, and you want to make sure that, you want to make sure that if they have, thoughts of self-harm, you want to see if they have the actions to do it. So that's, something that's sad, but you got to deal with. And some people that have depression have to go through, that type of suicidal thoughts. And it's something that you want to try and help, that's your priority. Okay, anyways, the next one. Should you expect abdominal pain for someone that has binge eating disorder? True or false? And guys, it is true. Gastrointestinal problems arise with binge eating because you eat excessively at one period of time. Okay, guys, a patient is having a panic attack. At which level of tone should you talk to the patient? Guys, you want to speak firmly and authoritatively. You want to, because when they're having a panic attack, you need to speak firmly, because sometimes it's harder for them to focus. Mild anxiety can help you in certain situations, and mild anxiety is okay. But if it's consistent anxiety, it's gonna basically make your focus go down, and you're not gonna be able to focus as well. You're not gonna be able to understand people as well. So if someone's having a panic attack, you want to speak firmly and authoritatively and help them.